we will go ahead and get started. Good evening, everyone. Thank you so much for joining our mid-session town hall. If you have come to our town hall session before, you might recognize me. I am very happy to see you here. My name is Elizabeth. I am Representative Jennifer Parenti's aide, and she represents House District 19. We are very excited to have Senator Sonia Jaquez Lewis from State Senate District 17 here tonight, along with Representative Karen McCormick from State House District 11 and Representative Kyle Brown from District 12. Each legislator is going to talk for a few minutes about their work from the first half of the 2023 legislative session and preview what's to come in the remaining days. And as a side note, unfortunately, Representative Parenti is currently doing the business of legislation and presenting Senate Bill 168 regarding
Elizabeth, can I interrupt you for a second?
Of course.
It looks like Karen is trying to get in.
Oh, okay.
And so I'm maybe seeing something. Definitely Karen McCormick is trying to get in.
Oh, okay. Great.
So maybe she said she's trying to use the link from the email. Sorry to interrupt, but if we can get Karen in, that'd be awesome.
Okay. All right. Great. So as I was saying, so Representative Parenti is currently in committee presenting Senate Bill 168, which is regarding gun violence victims.
We're gonna talk about that.
Yeah, we're going to talk about that. Absolutely. Access to the judicial system. So she had really hoped to be here, but she is doing the really important work of being a legislator and getting that bill through committee. So she does send her regrets. Her other aide, Emma, is here to say a few words, though. So we'll hear from Emma a little later. So if we could have everyone, we will have some time for Q&A towards the end of our town hall session. So you can just pop your questions into the question and answer box at the bottom of your screen if you do have anything you'd like to ask. And we will get to as many of those as we can. And if we can't, we will make sure to record those questions and get back to you via email if we're not able to answer your question live. So we can go ahead and get things started. I'm going to hand the floor over to Senator Jaquez Lewis, and we will get started. So thank you very much, Senator. Take it away.
Yeah, actually, Karen is still trying to get in. So maybe someone could text her the link. Hopefully, Emma. Sorry, not Emma. I don't know if Karen has anyone who's helping on tonight's town hall, but if we can try to work on that. Hi, everybody. I'm excited that I could join you. I barely made it through traffic to get in myself, but I'm so glad that all of you can join us. We are right smack in the middle of our session. Some of the biggest bills that we're hoping to tackle this year are definitely coming up. But before I get started too much, I wanted to see if Molly could put up a picture of there we go. Thanks, Molly. So this is a picture of meeting with some of the East Denver High School East High School students, the Angels, I believe they're called, on March the 4th. That was the week that they lost a classmate due to gun violence. That's Senator Marchman, Senator Cutter, myself. On the first row are some of the East High School students. As you know, if you get tweets and news alerts like we do all the time, there was another school shooting at East High School today. So I just wanted to take a moment and reflect on how this school and how many schools and communities, workplaces, just places all over our state are having to deal with mass shootings. 2 teachers, 2 faculty actually were wounded. If you haven't heard, one is in critical condition. And so I just wanted to take a moment. This was a remarkable day. The students marched. If I had all the time in the world, I'd show you some of the videos. The students marched all the way from their high school to the Capitol that was already scheduled as a Moms Demand Action Day. So we had hundreds of people all over the Capitol advocating for gun violence prevention measures. And I'm going to stop for a second and say that Karen is still trying to get in. If someone could please text her the link. We are doing everything that we can to try to get these measures through. We have 4 big measures for gun violence prevention. I know those of you that come to our town halls regularly know some of those, and I'll be talking about them. And hopefully if Karen can get in, I know she wants to say a few words too. Jennifer's Representative Parente is actually in the middle of presenting our big bill, which is 168. That is the Gun Violence Victims Access to Justice bill. And when we get the slide up in a second, I'll talk about it. But I just wanted to take a moment, and if you don't mind, just if we could send, if we could think about what these students have been going through. So thanks, Molly, for sharing that picture when I got to meet with some of those students. So let me just tell Karen that we're trying to get her in. We love doing things in the middle of session. It's called be as flexible as possible. So what I'd like to go through with everyone, and then we should have plenty of time for taking questions, is we've had some very good legislation that has made its way to the governor's desk. So I had 3 out of the top 10 bills, 5 from the Senate, 5 from the House. House Bill 1005 is an improvement. It's an enlargement of our Colorado PACE program, which gives, oh, okay. Does that mean Karen's in? We've switched the slide, but I'm not seeing Karen.
Hi, I'm sorry, I'm her aide. We're still trying to get her in.
Okay, do you want me to keep going then and not switch the slide, or are
yes,
we?
Yeah, please do.
Senator, yeah, you go ahead, keep going.
Okay, you want to switch the slide back? There we go. I love it that we can do technology on the fly. Okay, fantastic. It's a program where we can give state loans to commercial buildings, large ones that will revamp, remodel, install energy systems that are very efficient. It was actually one of the first programs in the state, was started in Boulder County. We're leading the way on this issue. The state adopted it, and now we push it out. We've had 42 counties in our great state that have participated in this. The latest was actually in how should I put this? One of our more conservative counties in El Paso. They actually applied and have used it to improve the Olympic building. Okay, we just got a message that Rep. McCormick, they probably have a vote, that she's taking a vote. So I'll keep going and we'll see if we can get her back in. And I actually can go through a couple of things on their slides because we all are working. They're working on some of my bills. I'm working on some of theirs. I'll spend just a moment on House Bill 1172. That was a bill that actually Representative Parente started it in the House, and it's a great bill for foster kids. So what happens now if you have a foster child that wants to change their name, needs to do some legal documentation? It dramatically impacts LGBTQ youth, which make up about a third, 25% to a third of foster children do identify as LGBTQ. And this helps them with some of the paperwork and the judicial filing that needs to occur. So it actually streamlines it for our foster youth, the foster families, the judicial system, and Rep. Parente identified that as an issue. And we actually got it through the Senate, and now it's sitting on the governor's desk. So I am going to go ahead and speak about, oh, great. Okay, I'm getting a message that Rep. McCormick will come back. So I'm not going to talk about any of the bills we're working on so that she can pop in. Let's spend just a minute on Senate Bill 4. That's the employment of school health professionals. That is making its way, I believe, over to the House. It has passed the Senate. That is one of the, hey, thanks for the cursor there. I see the cursor moving. I like it. This was identified as one of the top 10 bills for this session. It's an amazing idea. You have mental health professionals that are already licensed by our Department of Regulatory Affairs, but they're not allowed to be school therapists because they don't have a certification from the Department of Education. And that piece of paper is stopping many of these healthcare professionals, behavioral health professionals that want to work with our kids in crisis. And so Senator Marchman was working with Thompson School District. I heard about the idea, checked with our Boulder Valley School District and St. Vrain, and huge need. And this will help so many of our school districts. I want to share with you one piece of testimony that happened during that bill. It was from, and I don't know if she may be on I'll try to go over and see if she's on tonight. An amazing teacher in BVSD. She, out of the 16 years that she has been teaching in Boulder Valley, she's been to 20 suicides for former students, and they just don't have enough therapists. They don't have ready access. She said what a world of difference this could possibly make to her school and to other schools in Boulder Valley. So we're hoping that we can keep this moving and get it to the governor's desk. Let's see what else I might have time for. I'm also watching who's popping in. I'm gonna hold tight on 168 just in case Representative Parente can make it. Let's talk about the age discrimination bill. That we heard some pretty dramatic testimony on that bill. So that's on here as Senate Bill 58. This was a very fascinating policy that was brought to us by several of the senior groups. It used to be called the Senior Lobby. Now I think it's the Center for Aging, and also AARP. So what's happening for those folks that are maybe wanting to go back to work, say they stopped during COVID, or maybe they've had a change in life, change in their status, and they like to go back to work. When they go to apply and they put down when they graduated high school or when they graduated college, they're not getting callbacks. So a very interesting thing happened. We had testimony from several witnesses across the state, and I'll share the one that I knew about in Boulder. A friend, many of you know, I'm a pharmacist by training, and I work with a lot of nurses in Boulder County. A nurse applied for a job, and remember the shortage that we have right now in healthcare professionals, especially nursing. She applied for a job. She put down, this was a hospital job. She put down when she graduated nursing school, and she didn't hear anything back. And then she put down at a clinic that was also hiring nurses. They didn't request it. And so she didn't have to share when she graduated. She had an instant callback, instant interview, and now she's working. So we know these things are happening. So all the bill does, it's a simple change, but it's a dramatic one, an impactful one, is you no longer on the application, no longer can ask when someone graduated high school or when they graduated college and their age. And we hope that this will think of all the experience and the skill sets and the folks that we really need to keep our workforce moving, all those folks trying to get back in. We hope this will give a lot of people a chance. Now, if during the interview, on the first interview, they want to talk about that, that's fine. We just want to give people that initial entry into the job market. Let's see, I'm just checking. I have to tell you, I feel a little awkward being the only one that's going to be speaking. So we may take a lot of questions, and we may have some interesting interactions if we have time. I really should spend a little bit of time on the bill that passed today. This is a huge bill for our state. So those of you that are watching the reproductive rights issues post Roe versus Wade being overturned and the Dobbs decision in Colorado, after we had hints that this was going to happen, we quickly scrambled, and many of us, it was actually Senator Gonzalez deserves so much credit for this, put together a huge coalition of reproductive rights groups. And okay, I'm guessing with the change that maybe something is happening. There we go. I see Rep. McCormick popping in. I will hang tight here for a second. Rep. McCormick, can you hear us? What would y'all like to do? Do you want to put the slide up for a moment again, or do you want to? You know, Rep. McCormick is actually wanting to possibly speak about this bill too. Oh, she's voting again. Okay, I'll keep going. So anticipating that we might need to put in protections for Colorado, reproductive rights and abortion care, we passed REA, Reproductive Health Equity Act. That was last session. Well, now we know the response to Roe versus Wade, leaving and protecting women and families and people across the country. You see many states, dozens of states reacting to Roe versus Wade being lifted, and they're now coming after healthcare workers, coming after patients, and coming after our trans youth and trans adults by trying to deny gender affirming healthcare. So Senate Bill 188 actually protects patients and healthcare workers and gender affirming care. And the way that we've done that, and it just passed the Senate today, this is my bill with Senator Gonzalez. It's a very technical bill. It's a huge bill. It's 25 sections, but it protects healthcare workers in Colorado from being extradited or being attacked or being fined or having any kind of punitive action on them because they care for someone in our state or someone coming into our state. So many of you might have heard the story of Lauren Miller. She found out she was pregnant with twins in Texas. One of the twins had a genetic health defect that was the child would not be able to be a viable birth. Her obstetrician, she went to several healthcare workers in Texas, and they couldn't even tell her that she basically needed to go have surgery to save the life of the other twin and save her life. And they couldn't even give her that advice. So she had to basically, if you read her story or hear her testimony, and it's in the news quite a bit because she was so brave to share the story. She basically had to tell no one. She and her partner hopped on a flight. She couldn't tell her family. She couldn't tell anyone, because if anyone found out, they would be complicit and could be charged. And so she flew into Colorado and received the care she needed. And it's just one story. The number of folks coming to Colorado to Planned Parenthood and other clinics is in the thousands now. They're just coming in. Very good. Coming in from all different areas. Yay! Hey, Karen, how are you?
Good. Thank you for all hanging in there.
Yes. No, please jump in while you can. I was just explaining 188, but jump in wherever you want.
Great. Thank you all so very much. I was called to be a substitute on Behavioral Health Committee today, which is not typically my committee. And so I really thought I was going to have the afternoon and evening just wide open to get to the town hall on time. But this is what happens under the Gold Dome frequently. Representative Brown is also coming into the room with me. So, because he also was a substitute on the same committee. So thank you, Senator, so much for keeping the ball rolling for all of us. There's Representative Brown. We'll give him his own spotlight here in a minute. Sorry to have missed the conversation so far. I do want to give you my halftime report, which is, and I was telling Anastasia, you want to put a football on that or basketball, whatever halftime sport you all like to watch in your spare time. But anyway, this is kind of our legislative halftime report. And I kind of put these in categories because of some of the big things that are happening down here, whether I'm directly involved or indirectly involved. They're all critically important to me and many of you as well. So if I repeat anything that Senator Hawkes Lewis said, I apologize ahead of time. We do have this incredible reproductive rights package of bills that are working their way through. Thank you so much to the senator and all the senators that did such incredible work the other night getting through this package in a very respectful, deliberative way. It was wonderful to listen to. I happen to be the prime sponsor in the House on Senate Bill 190, which I can talk a little bit about here now so that you have a better idea of what this one's about. This one seems to be stirring up more questions and comments, which is understandable because it may not be crystal clear what this bill is attempting to do. And so I want to try to shed some light on that. There are clinics or centers across our state and the nation that have a specific purpose, which we're not trying to shut these places down. We're not trying to say what they are doing in a faith-based way is wrong. What we're attempting to do here, which is a critical need, is to have any particular center that is putting themselves out there to the public as offering reproductive care to actually say exactly what it is you offer and not allude or outright lure folks in thinking that they're getting either a full spectrum of care, complete comprehensive care, which is happening. And so it's really about being honest in what you're offering so that the public absolutely knows what it is to expect when they show up at your door. And there are many people that are actually seeking these types of centers and want the advice of what is given out. But there's a large number of people that are ending up at these clinics when they're actually looking for a comprehensive, full service reproductive care medical clinic. And that's what we're seeing an explosion of. And people are getting sidetracked, and that delay in care is not only psychologically harmful sometimes, but physically harmful when important medical care is delayed. And so the deceptive trade part of that is basically any type of advertisement, whether it be on a flyer or on a website. Say what you mean what you say, and be completely transparent about it. Simple as that. I used probably not a very good analogy. If you have a bakery and you say gluten-free bakery, gluten-free products, and then you go in there and most of your products are not gluten-free, and maybe you have to go across the street to get the gluten-free bakery, that is not being honest with the public. And we're just asking for transparency, honesty, and to not lure people in with some other wording in your website, that sort of thing. The second part of the bill is to address this, and this is where we're having to really educate people on what the second part of the bill does, is calling out this this idea of having a ability to reverse the first part of the medical abortion pill protocol, which is a 2-pill protocol. And the first pill actually blocks the ability of progesterone to get to its receptors. And there are some very, very small, minor part of the of medical professionals out there that somehow have gotten the idea that if you give large doses of injectable progesterone, it's going to undo that first pill. This is not based in science. This has not gone through clinical studies. And in fact, the one study that tried to go through this had to be ended early because of severe complications of some of the women that were involved. And so this is not supported by the American Medical Association, the American College of Obstetricians and Gynecologists. It is actually not a thing to say that there's such a thing as abortion pill reversal, because it does not exist. And so doing that also is hurting patients, also not being truthful. And for those that say we're taking away choice, if you're selling snake oil, it's not a choice. And so we want also there to be honesty in the practice of medicine. And for the very few people that might have a medical license that are doing this, we want to shine a light on that and make sure that the medical board pays attention to that and does their job. So 2 parts of that bill. I know that was a lot of words, but I wanted to just go into that a little bit on that. So then we also have some gun legislation that is coming through. Again, thank you, senators, for doing all the preliminary work on that. You all, and I bet Senator Hawkes Lewis mentioned that this is the 2-year date past the King Super shooting in Boulder. We also had a shooting at East High School today while we were on the floor. Every little thing or big thing that we can do in this space to save one life or more, I'm all in on. And that's what many of these bills will do. These are supported by an overwhelming majority of Americans across the nation, across Colorado. Most responsible gun owners agree with these policies. So happy to get those through. And then as a follow-up to some of the other things that I have been working on that are on their way. Many of you remember I may have talked about the bathroom access bill, which is waiting in appropriations to kind of get to the next stage. Many bills are waiting in appropriations for us to get through the budget process, which is coming up in the next 2 weeks. I'm sure Senator Hawkes Lewis talked about her water-wise landscape bill, which I am happy to shepherd that through on the House
Not
side
yet.
as well. You haven't talked about it yet?
No, go for it. Go for it.
Well, I may not be able to.
Go
So
ahead.
this bill, and many of you know I'm the chair of the House Agriculture, Water, and Natural Resources Committee. This is a bill that we really tried hard and discussed during the Water Interim Committee last summer. Was really hoping it would come forward as an interim bill from that committee, and we almost got it through there. So I'm really happy that Senator Hawkes Lewis decided to run it as a separate bill. This will on a high level, it will ask and tell HOAs to have alternative plans in their landscape plans that folks can choose from to move towards more drought-resistant plants, perennials that really can survive Colorado weather, use less water, so that we can move to a new vision of what we see as beauty here in the West. We are in the West. It is arid. Water is a scarcity. So it's really about helping us change our mindset of what is a beautiful yard. And for us to have that choice and those kind of preset plans in some cases for us to be able to pick plants and landscaping that eliminates or decreases the amount of grass that uses a lot of water, that we have been trained and conditioned to think is a beautiful lawn. There are other ways to see beauty. And so and really excited to hear that the Colorado Water Congress has voted to support this bill. So good job, Senator Hawkins Lewis. And with that, I'm going to stop talking and maybe pass it over to my good colleague, Representative Kyle Brown.
Hey, Kyle, I'm so glad you made it. Before you go, I just want to do a quick shout out. Dr. Warren Hearn is on this call with us, and he is a champion in our whole state, in our county. And I just have to say, Dr. Hearn, everything I do on reproductive services, I hope I'm doing you the honor and justice of all of us. So
I will ditto that. I'm so glad you're here, Dr. Hearn. We are continuing the fight for all that you have done.
Yes, thank you. Thank you. It's a pleasure to be with you all. And I'm so sorry to have been delayed in committee. It seems like every time we have one of these town halls, we're on the floor or in committee or something. So apologies for that. I just want to go over a little bit of the work that I've been working on. First of all, I feel so fortunate to be a part of the Boulder County delegation here, to get to work with the amazing Senator Hawkins Lewis, the fabulous and amazing Representative McCormick, and our entire delegation, all the great work that's going on. The bills that Representative McCormick and Representative Hawkins Lewis have talked about, I'm really happy to be standing right behind them, especially on the reproductive health issues, and the climate issues in particular. And I just really thank them for their leadership and their work, and we'll continue to support that work. The work that I've been doing since in the last month and a half since being appointed and being sworn in, I've been working on, in particular, on transparency of healthcare services in hospitals. And I'm happy to be joined by Senator Hawkins Lewis on this legislation to make sure that, if folks go into a hospital, if the hospital is religiously affiliated or otherwise, and decides not to perform some basic healthcare services, that the very least we can ask is that facility is honest with folks and tells them ahead of time about what's available and what's not. So I'm really fortunate to be joined in-house by Representative Brianna Titone to make sure that things like reproductive care, gender-affirming care, end-of-life care, people know when they go into a hospital whether those things are going to be available. We passed that out of the Health and Insurance Committee, and it's now in the Appropriations Committee. I'm also excited to say that my first bill has passed the House, and we've now given it to the Senate. So, Senator, it's in your court now. The update and the strengthening of the Colorado option, which is our state's public option plan, which is providing health insurance to 38,000 Coloradans, including 10,000 people who lack documentation, who maybe never had healthcare before. The strengthening of that program is in 1224 here. We passed that just yesterday in the House, and we're happy to see that moving forward. Look forward to seeing that continue in the Senate. House Bill 1234 is a bill that will help to promote solar energy, the electrification of our communities, and ultimately fighting climate change by reducing what is necessary to permit these solar energy projects. So it's about working with local governments, providing them with the resources so that they can make sure that solar panels, solar projects are getting permitted and onto people's roofs very, very quickly. That has also passed the Energy and Environment Committee here in the House and is now onto the Appropriations Committee as well. And 1240, which is an important bill to help make sure that people who lost their homes in the Marshall Fire, so many of them are underinsured, and it's really important for us to try to do whatever we can to lower the costs of their rebuilds. This is a bill that would provide a waiver from state sales tax for the materials to rebuild those homes. It could be in the $10,000 to $15,000 range for many people. Could make a significant impact on whether people have the resources to rebuild. And I'm happy to say that passed out of the Finance Committee last week and is now in the Appropriations Committee. So let's go to the next slide here. I have one more, I think. Yes, just yesterday, we introduced 1254. I'm running that bill with Representative Mabry to update habitability standards in housing after a natural disaster. So many renters in particular came home after the Marshall Fire and found a home that may have been remediated in some way, but was still unhealthy. And there are no health and safety standards for folks who are returning to those homes. So this is a bill that hopes to will help renters, give them some objective health and safety criteria by which they can apply and make sure that their landlord has remediated the property to an appropriate degree. So that'll be in committee here in the House in 2 weeks. And then yesterday we passed out of health and insurance this bill, Senate Bill 93, which again, thank you to Senator Hawkins Lewis. I feel like I keep coming to this well for her leadership on this particular bill. But it's a really important bill to limit limit medical debt, to prevent bankruptcies when people get sick or injured, because nobody should go bankrupt because they get sick or injured. And it caps the interest rates on medical debt and provides some incredibly important consumer protections. And I've been really pleased to work with not only Senator Hawkins Lewis, but the Attorney General's office on this particular bill. I've got 2 more bills coming, which are in various states of drafting and should get introduced within the next week or 2 here. One is, we've heard in our community in the wake of the Marshall Fire, a particular individual whose mortgage lender threatened to foreclose on their reverse mortgage simply because they lost their home. And so I'm working with another one of my colleagues here in the House to try to make sure that folks can't have their reverse mortgages foreclosed upon simply because they lose their home in a natural disaster. And finally, I'm working on a bill to make sure that people can continue to apply for their marriage licenses and their civil unions virtually. That's something that started during the pandemic. It's been very successful as a program. Boulder County in particular processes more marriage licenses than any other county except Denver. And so we want to make sure that sort of amenity is continue to be provided to people. So I'll be working on that with my colleague, Representative Parenti, who's presenting her bill in committee right now. So really appreciate, again, just nothing but gratitude to all of you for being here, and to my colleagues from the Boulder County delegation, Senator Hawkins Lewis, Senator McCormick. It's a pleasure every day to get to come to work, to get to work with you all, and to get to make Colorado a better place.
Kyle, you've done so much already in such a short amount of time. We just can't thank you enough for stepping up to serve Boulder County. It's just been terrific to work with you, and I'm so glad you're one of my favorite bills, the medical debt bill 90, Senate Bill 93. I'm so glad you're able to move that forward. It's a great bill.
Oh, we'll be on seconds on the House floor tomorrow,
Wow.
Senator. So we're moving that thing fast. So.
Oh, that's great.
Yeah.
Well, I'm not sure how we want to do this. How we could, if there's more questions, we can just kind of pass each of us. We don't have to do the slides. We can do the slides, however you want to do it. I guess maybe I'll take a moment to shout out to Eric. I think Eric said that he's in Lafayette, said he was really happy to be represented by myself and by Kyle. We love Lafayette. Eric, so thank you. Thank you for joining us tonight. I don't know, Karen, how do you want to, should we just pick
I just wanted to give Kyle some kudos too.
Yeah.
We were welcoming him to the delegation. Somehow
the screen changed for a second there.
Yeah, that was really weird. I just wanted to let everyone know who has a Representative Brown as their representative that not only is he incredibly smart and compassionate, but he also has an incredibly wonderful sense of humor. And so that's really important down here. And bringing that to the House, it's just been such a joy. So I too wanted to just call that out for those of you that may not know him personally. He's worth getting to know. So
yeah. Oh, there's always background noise at the Capitol. We'll tell you that for sure. I'd love to point everyone. I'm not sure if it's an open chat, but I definitely wanted to thank Dr. Hearn. He mentioned it right when you popped in, Rep. McCormick. I was just talking about the thousands of patients that we are seeing coming into Colorado for abortion services, for reproductive rights, or for
like a 3,600% increase, something like an incredible number. And they're ending up at these crisis pregnancy centers because they might have the word abortion on their website. And there's 51 of them compared to 20 actual full service abortion care facilities, reproductive comprehensive care. So of course they're ending up there, and that's not where they meant to go.
No,
So
not at all. Not at all. And the other thing that Dr. Hearn's message, because we just finished the 3 bills today in the Senate, the other thing that his message reminded me is that some of the patients delay to get care because they're trying to figure out how they're going to get to other states that are safe for them. And so not only is it putting a burden on folks like Dr. Hearn and Planned Parenthood and all the groups that are out there, but they're coming in with even more health concerns. And that's something that we heard in testimony in the Senate. So it's really putting their health at risk, the patient's health at risk. It's also putting, it puts our healthcare providers in an awkward situation. If I can share one more story, and then we can talk about whatever we want, but I found this out. This is one of the reasons why when they presented the bill to me, I was like, okay, yes, I've got to do this. Because as a pharmacist, if someone comes in, they fill the first part of their abortion services, their medication abortion service protocol is, they can fill the first part if they can get it. And then they bring the bottle or they bring the prescription to Colorado. And I, as a pharmacist, if I fill it, and then they take it back to Nebraska or Missouri or Texas, and that bottle is found, my name is on the bottle. Every pharmacist has to put, their name on it legally. They can extradite me. They can do a investigation. They can do a summons. They can try to extradite me. And in those 3 states, Nebraska, Missouri, and Texas, they could charge me with homicide. They could put me in jail. They could charge $100,000 fine. They could come after my pharmacy license. And I'm just using me as an example. It goes well beyond that. I'm talking about any service that is given by any doctor, healthcare provider from Colorado, Missouri, Texas, Nebraska, and other states are passing it. They could reach out and try to grab us as healthcare professionals and impinge on our way of living. So this is so dramatic and so unbelievable that these states think they can do that. That's why we're taking this very strong action. I'll stop there, and if we have a moment, I'll talk about the
Well,
stories.
I saw we need to get an update from Emma at Rep Parenti's office. So let's give her a chance to update since Representative Parenti really has a good slice of Longmont in her district. So Emma.
Hi, everyone. My name is Emma, and I am Rep Parenti's newest aide. I'm very happy to be here. It is my third day, so I'm really coming in at a hectic time, but I'm trying my best to learn everything, and I'm going to try my best to communicate everything that Rep Parenti has done. As we've mentioned, Rep Parenti can't make it with us today as she's in the judiciary, talking about SB 23-168, gun violence victims' access to judicial systems bill. And something that she really wants to emphasize about this bill is how it just keeps the gun industry and gun manufacturers accountable the same way that we would keep any other business or industry accountable here in Colorado. As well as we reach the halfway mark of the legislative session, as Rep Brown mentioned earlier, providing marriage certificates online is one of the bills that Parenti will be working on, as well as she is working on House Bill 23-1248, which is our Fair Campaign Practice Act. And this is just in basic to help have our municipal elections be a lot more transparent, as well as create donor caps that adjust over time to match inflation. And it prohibits political parties from contributing to the campaigns of municipal election candidates, and ensures that records of campaign contributions will be maintained by county clerks for 10 years in order to be more accessible to the public, as well as something that Rep Parenti really wants to emphasize with this bill is how it'll make running for office a lot more equitable. Usually the greatest barrier to running for office is not having the finances to do so. So a cap will really help make it so everyone can run for office and we don't have big money coming into our small elections. Thank you so much for listening to me stutter through all of that. Feel free to come by the office, 305. We're open. Come say hello. We're also available over the phone and over email. Rep Parenti reads all of our emails. And so, yeah, we're here to listen to you, and I'm very excited to help.
Thanks, Emma. Appreciate that very much. Kyle, what?
Good job on your third day too, Emma.
Yeah, really. Not many people have to dive in on a town hall on the third day. Kyle, what do you want to talk about? You know what? One thing that I think.
Oh, I can spit. I know Eric put in the chat about facility fees.
There you go.
Which has become a very hot topic here in the House. You know, I think I really appreciate what the sponsors are trying to do, which is to provide more transparency, more clarity for patients about, you know, the fees that are being charged in healthcare settings. And in particular, we often see, you know, physician practices get bought up by a healthcare system, a hospital or whatever, and then overnight the fees get increased. There's some magical fee that lands on top of it, and the service level hasn't really changed. And I think those are significant issues that we need to be addressing. And what 1215 is trying to get at is to provide some clarity about, you know, what's allowable and what's not. I think that, you know, the way the bill was drafted raised some concerns about the ability of hospitals to charge any fees for their services. And I don't think that's really what it was intended. So I think what we're going to see in committee on Friday when it comes to health and insurance is just the idea, you know, a significant amendments that will, I think, further clarify the scope and make sure that it's completely clear that yes, hospitals can still charge for their services, But in certain cases, these types of certain hidden fees, shouldn't be allowed. So I think what we're going to see is some real positive changes that reflect good work between the sponsors and the stakeholders.
Great, that's great, Kyle. I know Eric also said that, I guess there was an email that was sent out that it might affect salaries or not salaries, but paychecks. So I'm sure y'all will dive into that. So
yeah, and I don't think that's the intent, and I certainly wouldn't support something that would do that. So we're gonna continue to try to get at the root issue that I think it's really about transparency and patient protection and making sure that fees are appropriate and necessary in those particular cases, because there are some bad actors out there. And so it's really important to kind of try to make sure that the legislation is well tailored to the problem that it's trying to solve.
And it's also about making sure that those fees are charged in a way that the consumer understands the value of them when they are used in an appropriate manner that makes sense. And so it's really trying to peel back the curtain on that a little bit so that the public understands what the actual costs are and where it may not be needed. So I'll be in the same committee with Representative Brown, and we will most likely be hearing about some amendments that will come on that bill.
Great. I just wanted to take a moment to let folks know on the gun violence prevention measures. There are 3 big ones, actually 4, and one was started in the House, I believe, right? And then we had R3 in the Senate, so they're crossing each other. And I'm hoping everyone on this town hall, if you are supportive of what we're trying to do with those, and I don't know that we need to take time to put the slides up again, but if you'll take time to contact the governor, actually, and send an email to the governor and say how important all 4 of these measures are to keeping communities safe. They really align with each other. So Rep. Parenti is working on tonight. That's why she's not here. She's presenting the bill that I worked on with Senator Kolker, 168. And that is the enforcement mechanism to enforce the wait list, right? The waiting period, to enforce the raising the age to 21, to enforce ERPO. If someone was supposed to report, had a duty to report a red flag, this is why we're passing the Gun Violence Victims Access to Justice. So these bills are reliant on a way to enforce them. So I encourage everyone to please take a moment and contact the governor to let him know that these are very important and to please sign the bills. So if we can get them through, the House and same for our chamber on the other one. So what else? We
got you, Senator. We're going to get those bills out. I'll tell you what. So we heard we heard one in State Affairs just on Monday, and their judiciary is working on another 2 of them tonight. So I know we're probably gonna work all weekend, Saturday and Sunday, in order to get them done this week. So.
Yeah, and I was going to say, unfortunately, we don't have the nice rule that you have where you end by midnight. We prefer to go all night.
All night.
So well, that was one of the things I thought we should share with people, because if somebody looks at my list of bills and then they look at your list, they're like, why is that? What is going on with that? 1, there's only 35 senators, so we have to carry more bills, but 2, it takes longer for a bill to get through the House. You have all those people that want to talk, and you don't have the same rules that we do. We have a rule that we can do a consent calendar, and those folks that, if you're interested in that kind of nuance, we can put a bill on consent calendar. It's passed. That's it. It's on consent calendar. It's passed. So, and the way we vote is so different too. It took me a while to get used to it, but that's that's a little nuance that people don't realize. It's like, why does everything go so late in the house? Well, part of it is there's so many more people.
And it's not
Well,
because we think it's fun.
I was gonna say, we also have some members who like to talk a lot, so.
True. Yeah, what else? What else do we want to talk about? I'm looking in the chat.
Just a reminder, you can put your questions in the Q&A. I think we have time for a couple more. So just that little button, Q&A button at the bottom, go ahead and throw your questions in there.
Yeah.
I have to go get my charger. I'll be right there.
Okay.
4 minutes.
4 minutes. All right. Well,
Yeah.
Karen, how about if you don't mind, I'll finish the gender affirming care piece because
Oh, yeah. Were you talking about that?
yeah, we had some dramatic testimony on that. So not only are we having folks that need to come to Colorado for reproductive services and abortion services, but now they're fleeing states, LGBTQ, mostly trans youth and adults, they're fleeing because their doctors are being pressured not to write these life-saving medications who allow folks to be who they are. And, this is where I just met 2 transgender youth that were here today. We had a huge press conference on housing, and they walked up to me and they said, you're somebody. And I said, yes, I'm somebody, I'm Sonia. And they said, we're moving here because we're from Arkansas, and we're scared to death that we can't be who we are anymore because they're going to pass a bill that they can't even go have pride events. It's just outrageous. I just can't believe what's going on. And I'm just so glad that we have the support of everyone on this town hall and so many people to help us pass these protective pieces of legislation.
Yeah, well, and many of you know, but maybe some of you don't know that my eldest kid is a trans non-binary person. And so years ago, they were in search of a surgeon to perform a surgery to help them feel better in their body, as well as follow up a hormonal care. And at the time, they were in the UK, in London, and it was very easy. We had to have some significant out-of-pocket costs, but as far as access and ability to have that done was super easy. And I'm disappointed that Colorado is becoming an island among, these types of healthcare needs for people, but also proud that we are. And hopefully we will can show the rest of the country how it's done, how we can be compassionate to all humans and get people the health care that they need, no matter what sector it falls into. So these are really important. And, for those that say, why are you doing that now? We just look back to what happened last summer when they were saying, why are you trying to protect reproductive health care? We have Roe, and then we didn't. So that's why we have to do it.
Yeah.
Right.
Yeah.
And I was really, it's one of the things that I really value about being here with you all in this fight is just the importance of even when I like to think that what do I know about legislating? I've been here for a month and a half, but I like to think that it's a team sport, and right, and like we need folks to carry bills and we need folks to vote for them. And right now, especially as a more junior legislator, I'm just so incredibly honored and pleased to be able to support the great work of Senator Hawkins Lewis and Representative McCormick in carrying these incredibly wonderful bills on reproductive rights and gun violence prevention. And I will be right there with them supporting all that. So I'm just really anyway, I get a little teary sometimes. Everybody who saw my swearing in knows that I thought I would not be the guy who cries on the House floor, but here I am. So
yeah, you made us all cry. So that's okay. Trying is a healthy thing to do sometimes. So I think we need to close it out.
Do you want to put our emails in the chat? Everybody.
Oh,
has-
yeah.
Yep.
Why don't we take a moment and do that? And I'm actually looking for the governor's email. I know this is crazy. I just, text him, but I think he'd be very upset with me if I put his cell number in the chat. So I'm looking for his email because I'm really serious about everybody taking a moment and emailing the governor on gun violence prevention measures. Oh, good. There we go. Okay. I'm not sure if this is the right. I'm gonna try it here. Elizabeth, sorry, I'm stalling a little bit because I want everybody to have.
Oh, no, that's okay. I'm looking for it too. So I will,
Okay, good.
we can
Okay.
confirm, make sure that we get the same
Okay.
one.
Yeah, that sounds great. Okay, let's see.
There it is. Molly did it.
That's it. Molly,
Great.
you are the best. That is it. Oh, wait, is it the co-ledge? Do we need, it doesn't matter? You
They
probably
still
don't-
have state.co.us.
Yeah, the college only
Okay.
changed for the legislature.
Okay. Great.
Well, thanks. I want to thank Senator Hawkins Lewis and Molly for putting this on. I know you guys do the brunt of the work as usual, and I did the brunt of the work again this time, and I just really appreciate you all putting that together, pulling us together, and the opportunity to connect with all of you. So feel free to reach out to me if you have any issues. I'm always want to hear from constituents and be available. So.
Great. Hey, for next month, I'll just give a little teaser. Is that what they call it? Teaser before the next show, whatever it is. We might try a live Facebook town hall about the budget. So, and that's really fun because we will interact together. We'll all be in one place and we can do it live on Facebook. So watch for that and we can answer questions about the budget. Next week, we're starting the budget, I believe, in the Senate, right? Y'all, I think in the Senate.
Yep.
That's right.
Yeah, so we'll try to do April, all of us together, and I'll come over to the house and we'll answer budget questions. So watch for that email.
Okay.
Great. Well, thank you everyone so much for attending. Thank you representatives, thank you senators, and thank you everyone for being so flexible with the craziness of the mid-session schedule. It's everybody's favorite time of year, right?
Thank you all.
Okay, good night. Thank you.